Good evening po. Ako po si Sheila Meiji Payumo, nursing student ng Pangasinan State University, Bayambang Campus. Nandito po ako to share knowledge about family planning. So, meron po ba kayong idea about family planning?
Yung, ikaw mo.
Any idea lang po about family planning? Mga idea nyo po.
Ano, kung pagpaplano sa pamilya, kumbaga, kung ilan yung gusto nyo anak,
Ano ba
tama
po?
ba?
Tama.
Yun lang.
Ayan. Tama po. Sa family planning po kasi, dito po pinaplano kung ilan po yung gusto nilang ilan po yung gusto nilang anak, kung ilan po yung pagitan ng magiging anak nila, and then kung ready na po ba silang magkaanak, or ready na po sila sa financially, ganon. Tapos sa family planning naman po, dito po pumapasok yung mga contraceptives. May mga iba't ibang contraceptives po na tinatawag. So, mag-umpisa tayo sa wait lang, ayaw mag-talk. Ayan. So, sa oral contraceptives po, ito po yung sa birth control pills, para po sa babae po ito. Ginagamit po ng mga babae. So, sa birth control pills po, ito po yung kapag sa isang mat, meron po siyang 28 pieces na laman. So, dapat po tuloy-tuloy yung pag-inom nito kasi po para ma-prevent po yung pregnancy. Kasi kapag nag-stop ka po siya sa pag-inom or pag-detect ng pills na ito, hindi po siya magiging effective. So, maaari po na magbuntis yung isang babae. Pero kapag naman po, kumbaga pagka nakakalimutan mo uminom ng isang araw, pwede mo siyang ihabol. Kasi pwede pa naman po yun. And then kapag nag-stop ka naman ng mga 2 days, ganun, bumili ka na lang ng another 1 month or 1 month na pills. Kasi po para makapag-start ka ulit ng panibago. Kasi kapag na hindi ka na nakapag-take ng 2 days ng pills, maaari na mabuntis yung isang babae at hindi na masunod yung parang mauubos na hindi na mauubos yung 20 days na yun, yung pills na yun. And then ayun nga, kapag nakipag-intercourse ka, hindi ka mabubuntis, mape-prevent yung pregnancy ng isang babae. So, a pill that taken daily to block the release of egg from the ovaries. So, meron siyang advantage and disadvantage. Ito po yung mga advantage and disadvantage niya. 99% effective if perfect use, reduce the risk of pelvic inflammation. So, totally po, ibig sabihin, parang 99.7% talaga siya na effective kapag gumagamit ka ng pills, kapag tinutuloy mo yung paggamit ng pills. Tapos, disease, ovarian cancer, ovarian cyst, endometrial cancer, and iron deficiency. And it lightens the flow of menstruation period, cost-effective and reversible. Yung disadvantage naman niya is ayan. Yung disadvantage naman niya is do not protect against STDs. The pill may add to your risk of heart disease. If you take antibiotics and certain other medication, it may reduce the of the pill and must be taken every day. So next po is um, implantation or skin patch po. Sa implantation or skin patch naman, ito po yung nagpo-produce or nagre-release ng progesterone or estrogen. Kasi po, tayo po kasi di ba nagpo-produce po tayo ng progesterone and estrogen for egg cell, and enough na po yun para magpa-implant ka kapag magiging contraceptive po yun. Kasi, syempre, kapag nag-produce ka, tapos nagpa-implant ka, yung implante, ito po kasing skin patch is nagpo-produce din or nagre-release din siya ng progesterone or estrogen. So, nadadagdagan po yung mismong pinoproduce natin. So, ang nangyayari po is, parang pinaprevent niya po yung pregnancy kasi sobra na po yung napoproduce niya. So, kumakapal po yung daanan ng egg cell kaya hindi sila nakakadaan doon sa mismong ano. And then, ayun nga po, nape-prevent po yung pregnancies niya. Pero, kapag nagpa-implant ka po is kailangan po munang magpa-consult sa doktor pag magpapa-implant po. So, ito po yung advantage niya. Ayun, wait na po. Implant is a small flexible rod that is implanted under the skin of the upper arms, releases progesterone. Release steady dose of progestational hormone to thicken cervical mucus and thin the lining of the uterus endometrium. The implant typically suppresses ovulation as well. So, ito yung advantage niya. Advantages niya is a small flexible rod that is implanted under the skin of the upper arm, releases progesterone. It works up to 3 to 5 years and can be used by breastfeeding women. Gives some protection against cancer of the uterus, does not interfere with sex intercourse, and may reduce heavy and painful periods. The disadvantage niya naman po is does not protect against STDs. It may cause bleeding for the first few months, can cause side effects such as headaches, tender breast, changes in mood and sex drive, and bloating. Placement and removal require a doctor. Ito po yung sa skin patch po, ito dito po pwede po yan sa upper, dito po sa likod, sa ano po, sa may bandang puwet po sa upper outer arm, and then sa abdomen po. Ayan, skin patch is transdermal patch that continuously releases estrogen and progestin into the bloodstream. Each patch is worn for 7 days. Week 4 is patch free. So, yun, may advantages and disadvantages naman siya. 99% effectiveness with perfect use and 91% effectiveness with typical use. No daily contraceptive routine required. Simply and easy to use. Does not interfere with sex intercourse. Periods are lighter with less cramps. Then sa disadvantages naman niya is not as effective, 90 kg or 198 pounds. Possible skin irritation, may produce side effects and higher rate of transient breast pain can be noticed on the body. Prior method is it prevents the deposition of semen into vagina, or it's simply explained as preventing the sperm from entering a woman's uterus. Sa ano naman po, barrier po, example po dito, condom para sa lalaki. Pwede po sa lalaki at babae ito. Ito po yung sa ano niya, example niya. Ito po. Ayan. Barrier method ng male condom and female condom. So ano po, Eto, sa barrier method, pag nag-sex ang lalaki at babae, same same sila na naka-condom, may possibility na mabuntis yung babae kasi syempre pag kunwari nabutas yung isa sa gamit nila, ah pwede makapasok yung sperm cell sa ng female, sa vagina ng female. Ito yung mga how to put on and take off a male condom, then yun po sa female naman ito. So yung advantages nila is inexpensive, easily available and safe, provide protection on getting STDs, does not require medical consultation, prepared by many who have occasional intercourse, useful alternatives for those who want to avoid hormonal side effects. Some barrier methods are available without prescription. Sa disadvantages naman nila is demonstration by trained person for proper use, most common to failure due to displacement of devices. It may slip off or tear off. It can cause cervicitis, inflammation of cervix and location irritation, interfere with sexual sensation, not effective as hormonal method. Efficacy is highly dependent on the consistent and correct use, required fitting by healthcare provider, associated with an increased risk of urinary tract infections and toxic shock syndrome, require vaginal insertion and removal by the patient, difficult or unacceptable. Ito. So, punta naman tayo sa intrauterine method or IUDs, IUS. Ito. An IUD is small, flexible, often T-shaped device wrapped in copper that is placed inside your womb by your healthcare provider. IUD release copper into the womb. The copper alters the cervical mucus, which make it more difficult for sperm to reach an egg and survive. Paragard IUD is known to kill sperm due to anti-spermicide effects of copper. This device also changed the uterine lining so that it becomes thinner, and hence uterine cavity becomes more hostile for sperm and unavailable for implantation of an egg. It also acts as a stimulating agent for prostaglandins that inhibits production of certain hormones needed to assist pregnancies. So, itong intrauterine naman is kailangan din ng guide ng doktor dito. Ang ginagawa nito is para ma-prevent yung pregnancy is to change the way. Pag pumasok yung sperm sa vagina, papuntang uterus, imbes na didiretso papuntang fallopian tube para ma-meet yung egg cell, ang ginagawa ng IUDs is change niya yung way para hindi mag-meet yung sperm cell tsaka egg cells. So, ito yung advantage and disadvantage niya. Yan. Advantages ng IUDs is at 99% it's one of the most effective contraceptive methods. It can stay in place for up to 5 or 10 years depending on the type, but can be removed anytime. Fertility returns to previous levels once the IUD is removed. It can be used when breastfeeding. It doesn't interrupt sex. It affected by other medication. Sa disadvantages naman niya is eto. It requires a trained healthcare provider for insertion and removal. It may cause cramps or irregular bleeding. Some women experience headache, tenderness, and acne after an IUD is fitted. Small risk of infection or insertion and of expulsion. does not protect against HIV infection, AIDS, and other sexually transmitted, such as STI. So, ito. Inserted into the womb and gradually releases a progesterone hormone into the body system via the womb. This hormone encourages the female body to thicken the entrance of the uterus, making it difficult for sperm to pass, while it also thinning the lining of the womb so that eggs struggle to attach themselves. Ayan. So, next, surgical method of bilateral tubal ligation. It is a surgical procedure where the two fallopian tubes are blocked to prevent the ovule or egg from being fertilized. So, sa bilateral method naman is, sa babae lang to. Dito kinakat yung dalawang fallopian tube ng babae na um, hindi makapag-travel sa ovaries niya to fallopian tube to uterus, since di sila makakapag-travel kasi ang tawag dito, parang nawala na yung daanan nila kasi nakat na, so hindi na sila makakapag-meet. Ito na yung advantages and disadvantages niya. Intended to be permanent protection against pregnancies, safe and highly effective, quick recovery for women who undergo for this surgery. It lacks significant long-term side effects, not effect for sexual pleasure. It protects the woman whose health would be seriously threatened by pregnancy. Disadvantages niya is more expensive than vasectomy, possibility of the patient to regret, difficult to reverse if you can change your mind, pregnancies that rarely occur are more likely to be ectopic. Ayan. Ayan na. So, next naman is surgical method of vasectomy. Minor to block sperm from reaching the semen that is ejaculated from the penis. Itong vasectomy naman is para sa boys, para sa lalaki. Ito yung kinakat yung vas difference ng lalaki. Kapag nakat yung yung daanan ng sperm cell, so hindi na sila makakadaan, hindi na makakapag-ejaculate. Ibig sabihin ng ejaculate is ito yung nagre-release ng sperm cell. Siyempre, kapag hindi nakapasok yung sperm cell, kapag na-stuck siya, mabubulok yung sperm cell ng lalaki. Ito yung advantages and disadvantages ng vasectomy. Simple and fast, less expensive and no hospitalization. Prevent pregnancies better than any other method of birth control except abstinence. Only 1 to 2 women out of 1,000 will get pregnant in the year after their partners have had a vasectomy. Disadvantages niya is doesn't protect against STIs, so you may need to use condom as well. You need to keep using contraception after the operation until tests show your semen is free of sperm. Reversal may be possible in some circumstances, but it's not always an option. Reversal is more complicated than the initial procedure. Potential short-term risk of vasectomy including swelling, bruising, bleeding inside the blood in the semen, and infection. Excuse me po. So last po is the abstinent, not having sex intercourse at any time. Ito po yung tinatawag na no sex. Parang 100% effective na walang mangyayari na sexual contact sa isang lalaki at babae. Parang ito po yung ginagawa nila para makapagpigil. So, meron po itong advantages din and disadvantages. Advantages niya po is effective for pregnancies and STDs, free and available to all, safe, you can remain abstinent while on birth control, no medical and hormonal side effect, less likely to become infertile. Infertile ba? It may encourage people to build relationship in other ways. It may increase the creativity in relationship as partner find new ways to uh, intimacy with each others. Last is the disadvantages niya po. Not protection for unexpected contingencies. May be difficult to abstain, may not be prepared with the backup method if or where you decide to become sexually active. It may be very difficult to communicate to your partner about this method. Some people abstinence is sex frustrating and may feel as though they are missing out. Some who chooses to use this method longer may have a little knowledge about this method. So, ayun lang po ang mga na-discuss ko about contraceptive method. So, meron po ba kayong mga katanungan about sa contraceptive method po? Hello po.
Wala po.
Sige po, yun lang. Thank you po.